pressure this winter. The UK's population is growing and ageing, putting a greater demand on medical services. There are staff shortages. The Royal College of Nursing says there are currently 40,000 vacant posts. Then there's the issue of money. NHS providers say they got less than they needed in November's budget. This has led to operations and appointments being cancelled this winter. The government says the NHS is a top priority and the number of doctors being trained is up by a quarter. But Chris Hobson from NHS providers explained how the current situation is affecting patients.
I think we have now reached a watershed moment where it's very clear the NHS can no longer deliver the standards of care that are set out in the NHS Constitution. We therefore have a really important decision to make, which is, do we abandon those standards, which were incredibly hard fought to gain those standards in the 2000s, or do we make the decisions on the long-term funding of the NHS and social care to ensure the NHS has enough money to meet those standards? We need the government to make those decisions this year, by the time of the budget at the latest. So for the first time ever last year, the NHS missed all of the key standards on accident emergency, elective surgery, on ambulance waiting times and on cancer waiting times. We set a new trajectory to recover the A&E standard, which we're now going to miss. So we have now clearly reached the point where the NHS cannot meet the standards of care that we would, all of us in the NHS, ministers included, want to provide.
Let's talk now to Olivia Szepietowski, who's a doctoral researcher who specialises in obesity, and Tim Gardner. He's from the Health Foundation, a charity which carries out research and policy analysis into health care. And we are going to talk to we were hoping to talk to an anaesthetist as well, but he's slightly delayed, so we'll talk to him after 10 o'clock. Welcome, both of you.
Thank
you. Do you agree with NHS providers who represent hospitals and ambulance services in England that this is a watershed moment for the NHS?
So research by the Health Foundation has found that the NHS is now most of the way through the most austere decade in all of its history. It's currently 7 years into a massive funding squeeze, and we can't go on like this. It's simply not a sustainable position. The government did provide more money in the budget, which amounts to 1.9 billion extra for the year ahead, but that's less than half of the minimum funding gap that our analysis found was going to hit the health service this year.
So in cash terms, how much extra would the NHS need 2018 to 19, for example?
So in 2018-19, we found that before the budget, there was at least a funding gap of £4 billion.
Yeah.
And the government found an extra 1.9 billion within the budget. So there's still 2.1 billion at least. And that's before we start asking the NHS to do more rather than just maintain current standards for more people.
Olivia, can you describe your experiences of working alongside doctors, nurses and patients when it comes to your field, which is treating people with obesity?
Absolutely. Conditions are extremely stretched in hospitals at the moment. As we've heard on the news, there's patients struggling to get a bed when they need it, and how it's particularly affected my specialty, so bariatric surgery, that's surgery for weight loss, and to improve other comorbidities, so that's things like diabetes and high blood pressure and cholesterol. Unfortunately, these kind of surgeries aren't seen as essential to many different local authorities and trusts. And despite the amazing effects that they have and the people that they can really help, we're seeing that these surgeries are being delayed or cancelled, and often not just once, but multiple times for one individual.
Because they're not urgent.
Exactly, so they're not seen as urgent. But the issue is, at what point does it become urgent? When someone needs an operation, they need that operation. They've been found to have the requirements, and so it should really be that people shouldn't be delayed so much.
Should patients pay for things like gastric bands, for example?
It's an interesting argument. Gastric bands have been shown to be hugely effective in treating people with obesity, and particularly gastric bypasses and sleeves. Unfortunately, there's this huge stigma around obesity, and it's seen as being the individual's fault. My particular research focuses on genetic factors in obesity and in diabetes. One of the amazing results we see is that within hours or days of a surgery, somebody who was diabetic before is no longer diabetic. And that can save huge amounts of money for the NHS. So these operations, whilst they do have an overhead for the surgery itself and the follow-up, actually save the NHS loads of money because those people don't have diabetes, they don't require blood pressure medication, and so on.
Is there anything else, Tim, that the NHS, put money to one side, which I know is very, very difficult in this conversation, but is there anything else that the NHS could be doing right now in the short term to help itself over this crisis?
So as Olivia mentioned, things are incredibly tough within the health service right at the moment. We've seen it on the news throughout the last few days. Unfortunately, in terms of quick fix solutions, the NHS has done pretty much everything that it can do. Unfortunately, part of that response is to cancel some of the less urgent but still very important procedures that we know patients can benefit from, and that has a big cost and implication for the patients themselves. But the NHS, really, it's the only realistic option it's got in order to be able to cope with the tide of emergency need that it's being presented with day in, day out. And it's
not just the less urgent stuff, I'd take the point of what you said earlier, but a hospital in Oxford potentially considering cutting patients' chemotherapy sessions in order to free up staff, for example. They haven't made the final decision yet that they're keen to point out, but that sounds pretty drastic.
It does, and I think that highlights another really important issue. This isn't simply about money. Again, the government did find some extra funding specifically for winter pressures, but it was only allocated, or only announced really, less than a week before winter actually began.
That was the 350 million.
That's right, so it's not that helpful. So one of the big issues facing the health service is staffing. We need to have a very robust long-term plan and a long-term approach for how we train, recruit the right staff with the right skills and get them in the right places. We also need to do better at retaining the staff that we've got, and that seems to be the problem in Oxford. Not enough money, but simply not enough staff to be able to run that service safely.
A spokesman for the Department of Health and Social Care in England acknowledged there were problems. We know there's a great deal of pressure on A&E departments, that flu rates are going up, and we're grateful to all NHS staff for their incredible work in challenging circumstances, adding that plans are in place to help, including extra money for council-run care services so that people can be moved out of hospital more quickly, and the single biggest expansion in doctor training places in the history of the NHS, 25% in the coming years. The current model doesn't work, seems to be the consensus. And Jeremy Hunt, the England's Health Secretary, has talked about a long-term, sustainable model. What might that look like? You may not have the answer to that. If you don't, it's fair enough to say it, because it may be above all our pay grades. But what do you think?
I'm not sure there is that consensus that the model doesn't work.
OK.
So the issues that the NHS is currently facing, so a funding shortfall, staffing shortages, the growing needs of an ageing, growing, sicker population. No country in Europe is immune from any of these issues, and all of these countries are facing the same issues as we are. The model is a fundamentally sound one. There's quite a lot of research that shows that no type of health system performs universally better than any other type of health system. Go back 20 years, when there was some quite substantial funding and staffing increases for the NHS in England, and we saw some quite big improvements in quality of care flowing from that, and some other quite big advances.
So it is mostly about more money?
The model is fine. And
right, OK.
Yeah, and it's about staffing it and funding it properly.
Okay. What I would add is that it shouldn't be a party political view. It should be about coordinating across party and actually moving forward to try and make the NHS as sustainable as possible. It's reaching its 70th anniversary this year, and we want to see it last for another 70.
Thank you very much, both of you. Thank you. Very interesting.
Thank you.
Your views welcome, of course.